This is Dr. Vikas Chopra, Senior Consultant Cardiologist at Primus Super Speciality Hospital in New Delhi. So today I'll be talking briefly about the risk factors of heart diseases and one particular risk factor, which is the cholesterol or the lipid profile. So we know that there is a rising incidence of coronary artery disease or cardiovascular diseases in India. There are multiple reasons for that. One of the very important reason is basically the high cholesterol level in the patient. So what does high cholesterol mean, and what is the significance, and what is the treatment for that? High cholesterol basically means that when we measure the person's blood, we see various lipid subfractions. Out of them, there are lipid subfractions like LDL cholesterol, VLDL cholesterol, and triglycerides, which are the bad cholesterols. And there is HDL cholesterol, which we call as a good cholesterol. So when we say that the patient has high cholesterol level, we basically means that patient has high levels of LDL cholesterol or high levels of triglycerides in the blood. One of the very important reasons is genetic. Patients who have a very strong family history of heart disease, if their parents, their siblings, or their uncles and aunts have suffered from coronary artery disease and have had high cholesterol level, then usually that runs in the families. It is genetically mediated. Other causes for high cholesterol are basically lifestyle related. As we all know, cardiovascular diseases are classified as lifestyle related diseases. So if the person has the habit of consuming too many starchy, fatty, fried and processed food, then the chances are that the cholesterol level in the blood will be on the higher side. But typically we start the patient on lifestyle modification. Lifestyle modification is the first step and very important step for management of high cholesterol. Basically what it means is that you moderate a person's diet. Let the person have more of whole grains, more of legumes, more of fruits and vegetables, and less of oil, less of saturated fats like ghee and butter, more of vegetable oils like maybe olive oil or mustard oil, and generally avoid processed foods. By processed foods, we mean ingredients which are usually not found in a person's kitchen. For example, the bakery products or the commonly used snacks like namkeens and bhujiyas and all. So person has to avoid that. Apart from diet, a very important factor in lifestyle modification is the amount of exercise that a person gets. So we advise a person to get at least 45 minutes of exercise every day, because the guidelines of cardiovascular societies generally indicate that the person should get about 3 to 3.5 hours of exercise per week. The more a person exercises, the more the cholesterol is metabolized in the body, and the less of cholesterol is available in the blood for getting deposited in the arteries. Another very important component is avoidance of addictions, for example, smoking or alcohol use or any other drug use. And the management of high cholesterol is both lifestyle modification and medicines. If the lifestyle modification is not successful, or if the cholesterol level is elevated to a greater degree, then there are medicines which can bring it down. So this is in brief about the high cholesterol level. Thank you.